everyone, my name's Sarah Lavonne and welcome back to my YouTube channel. It has been 7 years since I started YouTube, and obviously I took a smidgen of a hiatus in there to build a whole program for nurses, but we are back. And when I was looking back at my first videos, I will link this one down below, I did a video all about the signs not to go to the hospital, one of them featuring the mucus plug, which is truly a medical term and also not the most sexy, but it really is a thing. And so I want to revisit a component of that and specifically talk all about your mucus plug and then what is it, how does it look? I have some demos. In fact, one of the things that I mentioned in that first video a long time ago, which by the way, I was like on my phone with like 2 cute little lights that the quality is so different. We have come so far. But I mentioned this idea of rubber cement was in my mind, what I've always pictured it to look like. And so I have it today and we're gonna talk about how the mucus plug can look compared to rubber cement. I'm gonna crack an egg and I'm gonna also compare it to bloody show because there is a difference, but you need to sort of expect that you might see both of these at some point during your labor. What is the mucus plug? It is a thick, sticky, mucusy, boogery type substance that plugs your cervix. And so if you haven't taken my childbirth class, go ahead and take the bundle birth class. Everything's linked down below. And one of the things I talk about, and you can see it in other YouTube videos as well, like my cervical dilation video, which I can also link, and I show you what it looks like for your cervix to dilate, all right? And so usually it starts out completely closed and we want it totally closed during your pregnancy. Now, if we look at a non-pregnant cervix, which is right here, the cervix is still a part of the muscle. So all the red is muscle here, all right? And so the cervix, when you're not pregnant and actually when you're pregnant, hopefully is closed. So you see like there's a little opening, it dilates a little bit in order to let the sperm in to get you pregnant. And then it actually needs to dilate completely in order to get your baby out. But what I call the cervix is the plug keeping your baby inside. Think about it as like a cork for a wine bottle. And so that cork plugs, it's closed, and what it does is it helps, one, keep your baby inside until your baby is fully grown, but 2, it helps keep the vagina bacteria out of where the baby is because them together for months and months and months are not compatible. It can actually make your baby very, very sick. That's also why you have a water bag. And so the combination of your water bag or the chorion amnion, meaning the amniotic sac that breaks when your water breaks, and the mucus plug help keep your baby safe. We love the mucus plug, so sexy, and everybody wants to know all about the mucus plug. So what does it look like and what can you expect for your labor and birth? First of all, your cervix is pretty much closed throughout your pregnancy. It should be closed. If it starts to dilate, then you might be in labor. And so once it opens up just a little bit, you're about 1 centimeter, and things start to soften, you can imagine that what was normally kind of stuck in there and held by the cervix now can start to come out. And so you may or you may not see a mucus plug. What does it look like? To me, it looks like egg whites. So I'm gonna just see if I can separate the yolk from the egg. Oh yeah, juicy. So I've cracked an egg here, and in this, there's like the watery portion, which I would compare more to like, to the water bag. But in here, there is like, if I can get it, oh my God, gross. It's so slimy. Help. Okay, I'm gonna get it. I'm gonna get it. Come on, come on. Oh, hold on, I got it. Okay, I think I got it. There is a slimy, no, that's not it. Oh, where is it? You're not gonna be able to catch your mucus plug like this, let's be clear. It comes out all in like one single glob, or it can come out like kind of mixed with your juices down there, and then it looks more like slimy. So one, your discharge may change towards the end of your pregnancy. And to use this as an example, you're like, why am I so wet down there? You wanna know whether or not that was your water bag or whether or not that was your mucus plug or whether that was just like vaginal discharge or even pee. I see the glob. Where are you? This is a disaster. Ah! Hold on, I'm gonna get it. Nope. I'm making the most mess of all time. Ah, come mucusy. Oh, I got one. Okay, so this snotty, chunky looking globber is what your mucus plug can look like. Normally it's like maybe golf ball size. At times it's like very small, but like, see how it's like kind of thick and globby like that? It can be a lot, it can be a little. It can be about this color, kind of like a beige tinge. See this glob? Yes, that is what it looks like. I have clients that send me pictures, videos, their underwear. I don't need to know. I just know if you see a big fat loogie come out of your vagina, it's probably your mucus plug. Now, if it's green, if it's brown, if it's really yellow, that is not great. Ideally, it's gonna be on the clear side or like kind of this egg whitey color. Now, I need to clean myself off and then I'll show you the rubber cement piece because I think rubber cement is also a really good demo of what it can look like. Our other option is rubber cement. Look at the color of this rubber cement. It is kind of like a milky, like yellowy, whatever. This color to me is probably the most reminiscent, although it could be various formats. And again, it comes out because your cervix is starting to soften and then it's no longer sort of like holding on to, for dear life, the mucus plug. And so as it softens, you may see some of that. Now this is way liquidy. So I'm gonna have to take some of this out, put it somewhere and let it start to dry up because I always remember in elementary school, you know, when this would like start to dry, it gets like kind of gloppy. And so, I don't know if that's a word, but I want you to see what it looks like when it starts to really start to dry out. I have a plate here and I'm gonna make my own mucus plug, let it dry out for a while. Because once it starts to dry, this thing, like the sticky, goopy situation is just right. While my mucus plug is drying, let me talk about bloody show. What's the difference between mucus plug and bloody show? Bloody show during labor is just vaginal bleeding that isn't as if someone were to like chop off your hand and just straight up blood. It's typically mixed with some of the mucus, some of the secretions, maybe some of your amniotic fluid if your water bag is broken. And so sometimes when you lose your mucus plug, especially if it's later in labor, you've been dilating for a while, you've been contracting regularly, you may see pretty blood tinged. We're gonna see if this works. This is beet juice. The internet told me would be a good substitute for blood. Oh my gosh, this is perfection. I cannot believe how good I made bloody show. So, and it's like, typically it looks like kind of clumpy like this. Basically, it's kind of like clumpy. It's mixed with the mucus. It can kind of be somewhat stringy and you'll see like strings of blood throughout. But basically you bleed and then it goes into a pad and you see like mucus with fluid with some blood, but it's not like dripping straight up blood. You have a nosebleed, you cut an arm off and it's just like straight blood like this would be. And so it's mixed. It's like, there's some bleeding there. Normally, when I see this and I'm your nurse or I'm your birth coach in labor, I am so excited. A lot of times you may not see this early on in labor. As labor progresses, you may see more and more. Sometimes you see a lot, sometimes you see a little. Sometimes like when we clean you up and like say a lot of times you have an epidural, you're in the hospital, you're 8 to 9 centimeters and we go to look at your pad and your water's broken, there can be like a whole pad full of this stuff where it's like stringy, egg whitey, mucusy, sexy, bloody stuff. And that just means your cervix is probably dilating. It's a very, very good indicator because your cervix, as you can see, super vascular, right? Meaning there's a lot of little baby blood vessels that go there. And so as it starts to stretch, they break a little bit. We don't want to tear it, but that little breaking of it causes a little bit of bleeding, which is totally fine. Your body's ready for it. It's prepared for it. So if you see a mucus plug, does it mean that you're in labor? No. All right, sometimes, and I will say like historically with my clients, a lot of times I'll hear like, I feel a little crampy, Or, hey, is this my mucus plug? And they'll send me a picture and I'm like, yep, that looks real nice and goopy and probably is your mucus plug. And I'm like, are you having contractions? We know that the definition of labor is cervical change with contractions. And so if you're not having contractions, you're not in labor, right? If you're not uncomfortable, you're not in labor. That is the telltale sign of labor. I tell you all about that and give you all the details of that for the different stages of labor in my birth class. We do know that if you lose your mucus plug, it likely means that you will go into labor in the next 2 weeks. So you're on the clock, but you're not on that much of a clock. And really though, if you're starting to feel contractions, it is a pretty good indication that things are softening up down there. So it's either something to celebrate, or sometimes for some people, it is the first sign of labor. But it's not like what labor is. And so let me know in the comments if you saw your mucus plug, what color it was, how it looked to you, how it all went down. I want to see, and then other people can read about that. This is perfection. This is exactly what the mucus plug typically looks like. Again, variations in color, but even down to the color, this is what it looks like. Consistency-wise, it's snotty, it's thick, it's mucusy, and you can imagine with it being that thick, like how potentially helpful it is to keep the bacteria out. It really is impenetrable by the bacteria. And so, once again, towards the end of your pregnancy, do you need that protection anymore? No, you don't really need that protection anymore because your baby's coming out so soon and you still have the amniotic sac once your water's broken. But if you don't see it, and that's the other thing is you may not see a mucus plug at all after this video. You'll probably be bummed because I hopefully excited to see your mucus plug now. But if not, then it just sort of got absorbed. As long as your water bag hasn't broken, if you lose your mucus plug and it's towards the end of your pregnancy and you're not in labor, you can still have sex. There's still that protection there. And probably, I can't imagine that your cervix is that open. And so either way, you absolutely can still have sex once you lose your mucus plug. Now, if you're GBS positive and you lost your mucus plug and you're in labor, that is so perfect. Then your doctor may not want you to, but in general, the answer is no problem. Yes, you can. The other fun fact about a mucus plug is that it can actually regenerate. And so if you lose some mucus plug and you are less than 37 weeks, it would be something that, as long as you're not having contractions and discomfort, that you want to definitely mention to your doctor. They may or may not check you. In my experience, they're probably still not going to check you and do a vaginal exam, but it's something to just note because it's a little too early before 37 weeks to lose your mucus plug. Again, if you do, it can regenerate, it can rebuild. It probably is constantly regenerating in there. But especially if you're, 39, 40, 41 weeks, great, something we celebrate, yippee-yo-ki-yay, you're getting so much closer. But it's not a reason to go to the hospital if this is the only sign, potentially, of labor. Thanks, everyone, for watching. Thanks for being here. Thanks for subscribing. Thank you for sharing your stories, your insights, and for commenting down below. If you want more from me, you can head to bundlebirth.com. I have my birth class there. There's a free visualization. There's a whole visualization, coping with labor, feedback, infant safety class. Join me for the fun. Get educated, get confident, and understand when to and when not to go to the hospital so that when you show up, you're actually in labor, ready to go, admitted, and then you can move your way towards holding your baby. As always, everything is linked down in the description box below. And then until next time, don't forget to flex and flow, and I will see you so soon. Bye. Oh my God. It's so slimy. Help. Ah! Come on! I'm just drying my mucus plug. Come on, snotter. What's happening? Oh yeah, I've never been more excited about mucus in my life.